Good morning to everyone. My name is David Dalmau from Mutua Terrassa Hospital and from the director of the chair of Health and Climate Change with University of Barcelona. Well, the mission of the chair is to promote the knowledge, the training and the diffusion, promoting the dissemination of the knowledge in the binomial health and climate change. This is possible because in our institution we have a differential fact that is surprising, because we will hope that that would be a common issue in the whole health care centers, but it seems that it's quite difficult to obtain the same data in the whole European countries. That is that we have the University Health Care Center, primary health care, the elderly health care and mental health care for an area that is 300,000 inhabitants, and that we have a comprehensive institution that we have the same data in the primary health care and in the hospital. So we have the whole data, and from the last 15 years ago, of the whole clinical issues in primary, elderly, and mental health care. That is because we wanted to make an approach in translational research and innovation on climate change. We focused in something that is a big challenge, but at the same time we have to cope a big solution. That is to create a networking, something that has been said before, a networking that share with some other partners that are more capable than us in several issues. That is why we have created a consortium with the Servei Meteorològic de Catalunya, Meteocat, that provide us every climate data, as well as UPC, the Universitat Politècnica de Catalunya, that has providing us the aggregation of data and the artificial intelligence. The same thing with la Universitat Rovira i Virgili, is a center that are international reference center in metabolomics approaches. The same thing with our research lab, where we are reference in epigenomic data, and the same with the University of Barcelona that constitutes our chair. So we perform disruptive innovation because we have our scientific challenge is to assess whether certain variables related to climate change have a negative impact in the clinical condition of people with highly prevalent chronic and non-communicable diseases. That is why we start doing several initiatives in the domain of research. The first one is the impact of climate change on health, in the most prevalent health, chronic disease and non-communicable disease, in two ways. In a retrospective way, that last 15 years ago, and in a prospective way that is since now to the future. The first one is to provide us some technological help tools that, as a traffic light, can help us to obtain data that can advise the patients to prevent them to go to outside if there is sorry, the wave, ¿cómo se llama? Impact, onades de calor? Heat waves, sorry, thank you. The heat waves, the same thing for the prescribers, because the patients, doctors can know in their patients which of them are vulnerable, and then provide them some advertisements about therapeutic issues or several issues related with their chronic conditions that prevent them to complicate their clinical condition. And the other is the managers, to provide them, to advise them about tools that can help them to reinforce several initiatives to avoid problems with the chronic and debilitating diseases. Another thing is, in the prospective way, is to perform metabolomic and epigenomic approaches that can give us some possibility to design biomarkers to individualize patients upon their clinical conditions, therefore to avoid them to come to the emergency rooms, departments, or to the primary care centers if they are feeling sick. And another one that is going right now in Terrassa, we are doing that in Terrassa, Sant Cugat, and the city of Rubí, is the study of the impact of climate change on the health of vulnerable patients with chronic disease based on climatic comfort of their homes. That is possible because Terrassa and Sant Cugat both are European smart cities, and thanks to the data that we have from MeteoCat, the same because we are doing this initiative with the School of Architecture of UPC in Sant Cugat, and our health evaluation that can give us several data providing which are the best information about conditions of their homes that can give us some advertisings to avoid or to give us them help in, for example, in heat waves, to give them some information about in heat waves to avoid some, for example, in air conditioning, in ventilations, or to go take the people more vulnerable to the climatic refugees. This, we will have data in the forthcoming and to present to the Ministry of Health. Thank you very much.
Thank you, David. Thank you very much. Gracias.